Feeding skills are both preparatory and supportive of speech acts. Inadequate development of feeding reflects directly on speech production. Mastication refers to the process of grinding and crushing food in preparation for deglutition, swallowing. Deglutition is the process of moving the bolus, which is the substance, generally food, into the pharynx through the esophagus. The articulator's primary responsibility is mastication, and speech is just a second pursuit. Development as an infant directly reflects upon performance during adulthood. Gross movements of the mandible during suckling and sucking ultimately give way to movement of the mandible for speech and mastication. Mastication and deglutition in adults is a sequence of 3 phases: the oral stage, the pharyngeal stage, and the esophageal stage. During the oral stage, food is prepared for swallowing. Although the oral stage may be a voluntary process, it can be performed unconsciously. Food is first introduced into the mouth and kept there by closing the lips. The lip seal requires breathing through the nose, so the tongue bunches up in the back and the soft palate is pulled down, keeping food in the oral cavity. So, food in there. The reduction phase is when food is ground up by the coordination of the muscles of mastication and the lingual muscles, so that it can easily pass through the esophagus for digestion. The tongue's main purpose is to keep food in the oral cavity by creating a seal along the alveolar ridge, while prepping it for the teeth. The tongue then moves the food onto the teeth and back into the oral cavity to be mixed with saliva, and then back to the teeth. The salivary glands help to secrete saliva into the oral cavity, aiding it in the preparation of the bolus for swallowing. For a healthy individual, bolus creation is relatively stable throughout the lifespan. The pharyngeal stage is a sequence of reflexively controlled events. As the bolus reaches the region of the facial pillars, the pharyngeal stage begins. Assemblies of neurons called the central pattern generator circuits, the central pattern generator circuits create the control mechanism for the organized but involuntary movements such as those that control swallowing, tongue-tip movement, and to lower the esophageal sphincter. When you take a bite of something hard, you automatically start chewing it, and the movement is an interaction between the masseter, the temporalis, internal and external pterygoid muscles, and the muscles of the tongue. To grind a hard bolus, there is an alternation between contraction of the muscles of mastication side to side, all while controlling where our tongue is. This pattern is the rest of a central pattern result of a central pattern generator. The esophageal stage is completely reflexive and not voluntary. This stage begins when the bolus enters the esophagus and is triggered by the distension of the upper 2 centimeters of the esophagus by the bolus. The bolus is transported through the esophagus to the lower esophageal sphincter by the means of segmental and inferior directed peristaltic contractions and gravity, arriving at the stomach for digestion after 10 to 20 seconds of transit time. The oral cavity consists of the lips, the tongue, the hard and soft palates, and the teeth. There are bones that contribute to the framework of the oral cavity. These are the paired maxillae, the palatine and the temporal bones, as well as the mandible, sphenoid, and hyoid bones. The oral cavity has assistance from the salivary glands to keep the cavity moist, the parotoid, the submandibular, and the sublingual glands. The pharynx is divided into 3 parts: the nasopharynx, the oral pharynx, located behind the opening of the oral cavity, and the laryngeal pharynx, located behind the inlet of the pharynx. The esophagus is divided into 3 segments: the cervical, thoracic, and abdominal. The cervical segment begins at the cricopharyngeus and ends at the suprasternal notch. This segment lies just behind the trachea, which is joined together with loose connective tissues. The esophagus is a 25 centimeter long fibromuscular tube that runs from the pharynx to the stomach. The tongue is a muscular organ in the oral cavity that enables taste, sensation, chewing, swallowing, and speaking. There are many muscles of the tongue, including the intrinsic muscles, which are the superior and inferior longitudinals, transverse, and vertical muscles, and also the extrinsic muscles, the genioglossus, the hyoglossus, the styloglossus, and the palatal-glossus muscles. The tongue contains different taste receptors, those for sweet and salty being towards the tip of the tongue, and sour and bitter towards the back. The masseter muscle is a paired muscle that originates at the zygomatic arch and extends down to the mandibular angle. It is one of the masticatory muscles. The masseter works to elevate and protrude the mandible and works in conjunction with the temporalis and medial pterygoid to close the jaw. The masseter is innervated by a branch of the trigeminal nerve. The temporalis muscle is another one of the masticatory muscles. It runs superficially from the temporal bone to the coronoid process of the mandible. The temporalis muscle produces movements of the mandible at the temporomandibular joint and facilitates mastication. Its anterior portion helps to elevate the mandible, while the posterior fibers pull the mandible posteriorly. The muscles of the velum, the soft palate, include the paladoglossus, the palatopharyngeus, the tensor veli palatine, the musculus uvulae, and the levator veli palatini. The soft palate aids in swallowing and breathing and plays an important role in speech. During swallowing, the velum elevates and retracts to separate the nasal cavity from the oral cavity. Muscles of the pharynx include the superior, middle, and inferior pharyngeal constrictors, the inferior pharyngeal constrictor stylopharyngeus, the salpingopharyngeus, and the palatopharyngeus. The constrictor muscles contract to narrow and assist with bolus transportation and help to seal the nasopharynx to prevent food from going upwards. The salpingopharyngeus contracts to elevate the pharynx and open the auditory tube when swallowing. Craniofacial nerve 7 carries nerve fibers that control facial movements and expression. This nerve also carries nerves that are involved in taste for the anterior 2/3 of the tongue. The glossopharyngeal nerve, which is the cranial nerve 9, provides motoparasympathetic and sensory information to your mouth and your throat and helps raise part of the throat for swallowing. The glossopharyngeal nerve decreases saliva production when you are done eating, and it helps taste food in the back of your tongue, and it also helps to lift the larynx, which helps to enable swallowing. This nerve also has sensory fibers that help sense pain when you have a sore throat. Vagus nerve 10, the vagus nerve, which is cranial nerve 10, is the longest cranial nerve in the body. This nerve is responsible for vocal fold adduction during swallowing. It also innervates the cricopharyngeus and controls muscles that are involved in the esophageal stage of swallowing. Reflexes are an unconscious response. They are automatic and do not require the brain. Swallowing can cause reflex closure of the glottis, elevation of the larynx, and a transient cessation of respiration. These motor acts are an example of the muscles activated during swallowing. The soft palate elevates, contracting the lateral and posterior walls, closing off the nasopharynx. Then, contraction of the velum, base of the tongue, and pharynx create positive pressure on the bolus. This drives the bolus to the negative pressure region in the hypopharynx. As every system, there can be impairments to mastication and deglutition, one being TMJ disorders. The temporomandibular joints are the two joints that connect your mandible to your skull. TMJ disorders can cause pain in your jaw joint and in the muscles that control jaw movement, resulting in difficulty chewing or pain while chewing. TMJ disorders can occur if the disc erodes out of proper alignment, if the joint's cartilage is damaged because of arthritis, or if there is trauma to the jaw. There are causes and treatments, and surgery is an option to help TMJ disorders. Another disorder impairment can be nasal regurgitation. It's when swallowed food or fluid backtracks and enters the nose. This happens when the nasopharynx does not close properly and may indicate a problem with nerves that empower muscles of the soft palate or the throat. There are many different examinations and diagnostic tests that can be run to observe nasal regurgitation. There are many ways to treat and help limit nasal regurgitation from happening as frequently, such as speech therapy, dietary modifications, medications, surgery, and there are a few more. So now the bolus will enter. It gets chewed up and it goes through and runs. It's supposed to run down the esophagus. I think it's because I'm holding it up into the stomach.